Beautiful, beautiful week to all the family of View Radio and to all our subscribers, all our viewers, you that like, that share, that comment. Beautiful, beautiful week to you wherever you are right now. And of course, the great, great soldiers of Healthy Corner, you are most welcome once again. And today is another beautiful day. We're going to be doing it together. Healthy Corner is where we talk about our health mentally, physically, emotionally, financially, and even spiritually. No one is exempted. We talk about our health because it is very paramount we take care of our health. There's a popular saying that health is wealth. Yes, I concur to that 100%. If you're not healthy, you can't be wealthy. So we need to take care of our health in our own little way. When things now get out of hand, we also advise you seek help of a doctor, a professional one at that, not just any doctor. That is what this show entails. And thank God that we have been doing it and it has been yielding good results for you and for all of us here. Today will not be an exception. We'll be doing it again together and we'll be talking about a beautiful, beautiful topic. You know, so many of us are ignorant of some little things, and because of our ignorance, we're suffering from it. If you're ignorant of headache, you fall victim and you suffer for it for a long time. If you're ignorant of backache, the same thing. Body pain, the same thing. You will suffer a great deal. That is why we deem it fit to be coming on board to talk about a lot of it can be issues, it can be diseases, it can be infection, all round clock. All of this is just to make us get us aware and also help us prepare and get prevention than getting the cure. We get prevention to all of this. And this morning, we'll be talking about infertility. Infertility, not particularly in a woman or in a man, but infertility. You know, when you hear infertility, you just think that it's likened to women, that a man has no issue with that is likened to women. But you are wrong. It's both men and women. Both of them suffer from infertility. And before we go on, let's go on a quick break. My name is Madam Chi. We'll be right back. All right, you're welcome back from that break. Before we went for the break, I say we'll be talking about infertility. So we'll be diving into now infertility. Infertility is a disease of a male or female reproductive system, which is failure to achieve pregnancy after the period of 12 months or not able to conceive after unprotected sex, not getting pregnant despite having careful times, is an infection of the reproductive system. inability to get pregnant after the period of 1 year, constantly having intercourse for 1 year, unprotected intercourse for a year, and not having been able to conceive or get pregnant. So it's an infection of the reproductive system. It's either male or female, which is a failure to achieve pregnancy after a period of 12 months, or not able to conceive after unprotected sex. Not getting pregnant despite having carefully timed the time for you to get pregnant, but you're unable to get pregnant. That is infertility. Unable to get pregnant. You've tried, you've done the necessary thing. They say count your ovulation, you count your ovulation, and after the your ovulation, you did it, yet there is no result. You are unable to get pregnant. That is what we are talking about this morning: infertility. Infertility, and there are series of causes of infertility. Series of causes. We'll be looking at few causes of infertility. In case you find yourself in any of this category, I will always advise, seek a help of a professional doctor, a gynecologist to be precise. A gynecologist will do well with you on this case. So when you find yourself in any of this category or suffering from any of this thing, you need to see a doctor. Blocked or damaged fallopian tube. This is one of the cause of infertility. Your fallopian tube is blocked or is damaged. How will I know that my fallopian tube is blocked or damaged when I don't seek help? When I don't go for checkup? How would I know that my fallopian tube is blocked or probably damaged? You can't assume and know it. You can't sit at home and know it. You need to go to the hospital. That is what we are talking about. Lack of regular ovulation, the monthly release of an egg. Your ovulation is not coming regularly as a woman. So what will produce the eggs that are going to come in and germinate like a baby? What is going to produce it? When your ovulation is not regular, or you don't even see it at all, how will you know? You can't know it sitting in the comfort of your home. You can't know it just assuming or thinking it might not. No, you only confirm what the case may be when you go to seek for help. Endometriosis, and I would really like us to look into this. Endometriosis is, a lot of people are going through this pain and this infection or disease, I may call it, that is causing a lot of damage and harm in the life of women. Endometriosis, a condition where tissue similar to lining of the womb grows in another place outside the womb. It causes pain, it causes discharge, it causes bleeding. So this also can affect you from getting pregnant. It can affect your fertility. It can make you not fertile. It can affect it. You can be infertility if you're suffering from endometriosis. And poor quality semen. Poor quality semen can also cause infertility. Are you sure what you're bringing out is high in quality? Are you sure what you're bringing out is able to join with the egg of a woman and produce a child? How sure are you? So poor quality semen, inadequate level of certain hormones in both men and women, inadequate levels of some certain hormones in the body of the woman or either the man can cause infertility. Age-wise, age can also cause infertility. Age-wise, for women particularly, being in your late 30s or 40s, but for men, it begins after or in your you're getting closer to your 50s. So age can also be one of the factor why one is infertile. As a woman in your late 30s or 40s, but as a man, it's when you're getting closer to your 50s. So how are you age wise? Are you okay? You need to check all of this and don't just sit and assume that you are fine. Don't just sit and assume that, okay, don't worry, we're going to get pregnant in due time. The first year is gone, the second year is gone, the third year is gone, fourth year, and you're counting years without doing anything about it. Infertility is what we are talking about. We'll be right back after this quick break. All right, you welcome back. Don't forget to subscribe to all our social media channels. That's where you need to follow, subscribe where you need to subscribe, and don't forget to turn on your notification button in case we're going live on any show. You will be notified what we are talking about. Any podcast that adds values to you, that adds value to anybody around you, do well to share and spread it around. And today we are talking about infertility. Talk about the causes of infertility, and let's look at some symptoms of infertility. There are some symptoms you see and you now feel it's normal. I will always advise, don't just assume everything is normal when it comes to medical wise. Don't assume it's normal until you run some series of tests and it being confirmed normal, then it is normal. But on your own, don't assume. So symptoms of infertility. The main sign of infertility is being unable to get pregnant after 6 months or 1 year. But some people also show physical symptoms. Some people also show physical symptoms like issues with ejaculation. You have ejaculating, you find it difficult to ejaculate, issues with ejaculation is one of the symptoms of infertility. Issues with ejaculation, irregular vaginal bleeding. You bleed in your vagina, irregular period or no period at all. Yes, people that said my period stopped a very long time. If you are a mother of two, three, or four, you're done giving birth, it still does not feel all right to me. So irregular period or no period at all is one of the symptoms of it. There is no period, and it only takes miracle. It only takes miracle for you to have to reproduce if you're not seeing your period or your period is not regular. Unless it is miracle for you to produce. And pelvic or abnormal pain, some pelvics that okay, I think in any of this category, the best you should do is to seek the help of your doctor for advice and then, or for the steps to take your to reproduce and get pregnant and have your own like every other couple out there. Can infertility cure? The answer is absolutely yes, but depends on the cause of your infertility. Infertility can be cured, can be done, it can be eradicated, can go away, but it depends on the cause of infertility. In 5 to 90% of cases, lifestyle modification, medication can help put a stop to it in 85 to 90% cases, or surgery can treat infertility and also allow person to conceive. So depending on the cause of your infertility, then it's cured and you're able to get pregnant or conceive. If you're not affected, taking preventional measure is advisable. I will always advise that. I'm an advocate of that. You take prevention, you prevent it than curing it. Probably you're young, you've not started giving birth to children, you're not even going to any serious relationship, how much more going into marriage. I think to go and run some series of tests. If you're in any of this category, if you're seeing any, if you have any, or you are even thinking, okay, I'm fine, but at the same time, you need to go check up and know that you are perfectly okay. So I will always advise a preventional measure. It's better than you curing it. So if you're still single or young or newly in your marriage, you can also take this preventional measure. Or you are there and time is counting, nothing is showing up. I tell you, this can also work for you. Like every good and professional doctor will say, prevention is better than cure. So you can take these steps to protect your fertility and also prevent infertility, especially while trying to conceive. If you're trying to conceive, you need to take these measures very seriously. Firstly, eat well and balanced diets and maintain a weight that is healthy for you. Eat well, eat a balanced diet, and then maintain the weight that is good for you. Don't be overweight. Don't be too big for your body size. It's not advisable. So if you want to take the preventional measure, you must eat well and then eat well and eat balance, not just eating well, balanced diet, and then maintain the weight that is good and healthy for you. Don't smoke. Yes, don't smoke and don't misuse drugs or don't drink too much of alcohol. Too much of alcohol, yes, it can also cause it. So you better prevent it now that you still have the time. Do not smoke. Even the smokers who say smokers are liable to young, but despite seeing all of this thing, they still produce it, yes, and you still smoke it. You still smoke it. No need. So don't smoke. Don't abuse drugs and don't take too much of alcohol. Don't abuse drugs. Don't just take drug without a prescription. You are not a doctor. Don't have headache and you go to buy drugs and you say this is going to be okay for me. No, you must take drugs that are prescribed. You are not a doctor. You have no profession. You don't know prescribe drugs. So don't prescribe drugs by yourself for yourself. It's dangerous. Stay physically active, but don't overdo exercise. If you're trying to Stay physically active. Do exercise. You know, some of us overdo the exercise. Then you that you're trying to conceive, how then will you conceive? So don't overdo exercise, but stay physically active. When you say active, you know you're active. Undergo fertility preservation procedures. Undergo fertility preservation procedures. Freezing eggs or sperm. Go and undergo this process. Undergo the procedure. When I say, are you sure you are okay? You need to be very sure that you are okay. Not as you are. My mom gave birth to their family, everybody, my siblings, everybody, wife in our family, and all of them are married and they have given birth. And me, probably when I get married, I'm going to children. No, it doesn't work that way. It doesn't work that way. You only get to know you are okay, you are fertile when you take the necessary step that is expected. Limit exposure to environmental toxin. It is very important. Some of us we live in an environment that is dangerous to our health, that is deadly, that can kill and destroy some of the cells in our body. So don't be exposed to environmental toxin, or don't just limit the exposure to it. Get treated for STI, sexual transmitted diseases or infection. Get treated for it. Get treated for it. All right, I'll be going on a quick break. And when I get back, we'll continue from where we stopped. Don't go nowhere. Get treated for STD, like I said, sexual transmitted disease, sexual transmitted infection. Get treated. Go and do your checkup. Go and check yourself properly, because if infertility has affected a lot of people because of our ignorance, and you think you are normal. Many couples today that are waiting, that are not able to conceive, have not even gone to check properly, have not gone to do any test, any checkup at all to ascertain how fertile they are. They haven't. You just assume my parents gave birth, my siblings gave birth, of course I'm going to give birth. About 1 in 5 married couples in which the woman is between 30 to 39 have problem conceiving baby, compared to about 1 in 8% married couples in which the woman is younger than 30. As you advance in age, your chances reduce it. Like they will say, you've entered menopause. Not even menopause. before menopause because of the age range. But those in between 18, 20, 22, 25 to 30, they still have the chances of getting pregnant easily. The best strategy I will advise a couple trying to conceive would use is having sexual intercourse more often around the ovulation time, because the menstrual cycle lasts for about 28 to 32 days, which is counting from the first day of the last period. A female will usually ovulates anywhere between the 11 and 21 days. So try it, and that period will count. Everything will change. But do you even know how to count your period as a woman? You want to conceive, you want to have babies. Do you even know how to count your period? Do you know when you're going to be ovulating? Do you know when you're supposed to meet your husband? Do you know the right time? It's not every time that you have intercourse that these things work. No, if you're waiting to conceive or if you're trying to get pregnant, you need to count all of these things. And any person whose cycle is shorter than 21 days or longer than 35 days will be seen. You should, as in, really need to go and see a doctor. If your cycle is shorter than 21 days and longer than 35 days, you really need to see a doctor. If you're talking about infertility, you must make sure your role is played well. If you play your role well as a woman, then the husband needs to play his role well. Don't say, my wife, go, me, I am okay. No. Even a man can suffer from infertility. So make sure that the both of you are fertile. If the both of you are fertile, then you now start trying. Not when you not ascertain the status of your fertility and you think everything is okay. No, 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 no. You have to go see a doctor and make sure that both of you are okay in order for us to eradicate infertility from all of us. Let's join hands together and do away with infertility. It has really eaten deep in our community. Let's do that together by making sure you go see a doctor and know your health status and know what it looks like. If you as a man, you're okay, you as a woman, you're okay, then you are good to go. Then children will be crying around your table. Health is wealth. Whatever it will cost you, make sure you stay healthy. Make sure you take care of your health, take care of the health of your family, because that is where your wealth starts from. That is me signing out for now. I say stay tuned, stay connected, share, like, and comment. Be Radio Family, we love you all. Bye bye.